Hello, and welcome to my presentation. My name is Dayna Hammer, and I will be discussing how the use of mindfulness training and meditation practices can help adults diagnosed with hypertension decrease blood pressure in conjunction with their prescribed medication regimen in comparison to their hypertension medications alone. Health and fitness are this student's passions. Flooded all over social media, you will find hundreds of fad diets convincing individuals that things such as the carnivore diet, consisting mainly of the consumption of red meat, is a healthy way to lose weight. For individuals who may already be struggling with hypertension, this sort of diet can be detrimental to one's health. This is important because hypertension often has no symptoms, yet it significantly increases the risk of heart disease, stroke, and kidney failure. This makes it a crucial but often overlooked health condition. It is one of the most common chronic conditions affecting people of all ages and backgrounds. Hypertension is influenced by genetics, lifestyle, diet, stress, and underlying medical conditions, making its management complex and individualized. Ongoing research is discovering new medications, lifestyle interventions, and technology-driven solutions to help control blood pressure. Unlike many other chronic conditions, hypertension can often be prevented or controlled through lifestyle modifications, making public health interventions highly effective. According to the National Library of Medicine, 1 in 2 people of 20 years old or greater in the U.S. has hypertension, with only 39.64% on medications having well-controlled hypertension. Due to these findings, the PICO question this student came up with is: an adult diagnosed with hypertension, does the combination of antihypertensive medication and regular meditation practice compared to antihypertensive medication alone result in improved pressure control and reduced stress levels over a 6-month period? Major findings. This student was able to find several studies that evaluated mindfulness practices and their effects on blood pressure management. Out of the studies, this student utilized 4 articles that were randomized controlled trials, which according to Pullett and Beck are the gold standard for experimental research. The other article was a quasi-experimental design without randomization. All 5 articles had similar findings showing a decrease in blood pressure when different meditation techniques were employed into their daily routine. As you can see, the findings are listed below. In Article 1, it discusses how the mean systolic and diastolic blood pressures, how they were not significantly different at baseline between the 2 groups, but post-interventions, the mean systolic and diastolic dropped significantly in the intervention group compared to the baseline group. For Article number 2, participants in the OMBSR group, which is also known as the Online Mindfulness-Based Stress Reduction Group, they experienced significant decrease in both systolic and diastolic blood pressure along with heart rate. Article number 3, mixed modeling analysis showed a significant decrease in systolic blood pressure during all the follow-up months. Article number 4, participants in the MBBP program, also known as the Mindfulness-Based Blood Pressure Reduction Program, they experienced a significant decrease in systolic blood pressure at the 6-month follow-up. For the MBBP group, they actually showed a 5.9 millimeters of mercury reduction in systolic blood pressure from their baseline. So this reduction was 4.5 millimeters of mercury greater than what the control group experienced. And for Article number 5, the participants who completed the adapted MBSR course, which is the mindfulness-based stress reduction course, they exhibited a significant decrease in anxiety levels compared to the control group. The MBSR group demonstrated notable improvements in self-regulation abilities, indicating a better capacity to manage thoughts, emotions, and behaviors. Gaps in literature. The gaps in literature that were identified were limited sample diversity, so the research was based on a narrow population, making findings difficult to generalize across different demographics, settings, or cultures. Insufficient longitudinal research, meaning many studies that we went over were focused on short-term effects, but failed to examine the long-term impacts that these studies may have on individuals' hypertension. Gaps in implementation research. So while the studies provided evidence-based recommendations, there are some limited research on how these findings are practically applied in the real-world setting, meaning that are individuals able to keep up on this mindfulness practices, this meditation on their own without being guided to do so in an experiment. Research needs and next steps. So the research needs identified that could help orchestrate the next steps would be further empirical studies. So more research is needed to validate the findings using larger, more diverse sample sizes. Also longitudinal studies, meaning investigating long-term effects to understand trends and sustainability of the interventions utilized. Comparative studies, examining different populations, healthcare settings, or intervention methods to determine best practices. This concludes my presentation. Below is a list of the references used in the presentation. Thank you so much for listening.